You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. On today's episode, we have a very special guest. Her name is Sarah, and she's one of my nurses. She and I have worked together for many years, and I wanted to bring her on the show today to discuss a very important topic. How are you doing today, Sarah?
I'm doing well. Thank you for having me on this show today.
Of course. So, Sarah, tell me a little bit about one of your family members who's having some difficult medical issues.
So, my younger sister, she's 23 years old. She's had quite a medical history since she was born. But recently, it's been 4 years, she was diagnosed with rheumatoid arthritis in her right knee. So she's been having some issues because of her disability and then also because of rheumatoid arthritis.
Okay, I understand. So tell us a little bit about rheumatoid. What does rheumatoid arthritis mean to you, or how would you explain it to someone who's never had it before?
I think that it's inflammation in your joint. It could be any part of your body. In her case, it's her right knee that's being inflamed. And it's only her right knee. For a few patients, I know that it spreads around their body, but for her, it's only her knee.
Okay, very good. And in the medical field, rheumatoid arthritis is in the category of autoimmune disorders. So autoimmune means the body is attacking itself. And what happens in rheumatoid is that the body creates antibodies against your own self, meaning your joints, your muscles, your blood, and other important structures. And it sounds like what's happening with your sister is that the antibodies are destroying her knee joint because they are targeting that. Mm-hmm. And you were telling me that she's having difficulty walking now?
Yes. Since she's been diagnosed, she's been through many different procedures. They've done a scope on her. And now that's been 4 years, she's having a trouble with extending her knee completely. As in her left knee, she's able to extend it, flex it just normally, but not her right knee because of that reason.
Okay, I understand. And you mentioned a scope, so she has seen an orthopedic doctor?
Yes, she has.
Okay. And what did they find when they did the procedure?
Well, when they did the scope, they said there was a lot of inflammation and they kind of shaved it off, cleaned it out, and tried to see if it would make that better. In her case, that did not happen. It just got worse.
Okay, I understand. It sounds like it's a very disabling condition for her. Now, in terms of the other management with the specialist, she sees a rheumatologist.
Yes.
And what has the rheumatologist been doing for her?
So she's been going to a rheumatologist for about 2.5 years. We've actually been through 3 rheumatologists trying to get different advice, but the one that she's with right now has been giving her courses of steroids and other type of medication. Currently, she started off with Humira and methotrexate. After a few months, it stopped working on her, and then they changed it to methotrexate and Enbrel that she takes weekly.
Okay, I understand. And what you're describing is actually very common because what happens with autoimmune disorders, we try to immunosuppress the body. So steroids are immunosuppressants, Enbrel, Humira, methotrexate. These are all called biological agents. And so biological agents hopefully will calm down that switch where the antibodies are attacking the body itself. And hopefully that will allow some relief. But unfortunately, rheumatoid is progressive. And over time, even despite all the medications you mentioned, it's just not working. And you recently told me that she is now getting a second opinion by another orthopedic doctor.
Yes. So we recently, because she's been going through a course of treatments, she's done medications, physical therapy, different type of splints from surgeons. So we recently went to a orthopedic surgeon in the medical center, and he recommended to do a surgery on her, a whole complete knee replacement, which we were kind of iffy about because it's such a big procedure. But he explained to us that we've done so much for that to help her knee that the last thing that they recommend is a surgery for her.
Okay, makes sense. And the surgery, I believe, is knee arthroplasty,
yes,
which is the procedure of choice in this situation. And again, just as a reminder, she's 23 years old.
Yes.
And so she's very, very young. She was otherwise, doing pretty well until the rheumatoid attacked her joint in the right knee. And my understanding with the orthopedic surgeon is that they will remove the part of the bone that is damaged. And arthroplasty means cutting away a bone. And so with the knee surgery, they will remove part of the thigh bone, they'll remove the kneecap, and they'll remove part of the shin bone. They're going to replace that with an artificial joint, which is usually titanium, and it has other polymers or other polyelastic polymers with it to help act as a cushion. So when they remove the damaged parts, they have to replace it with pieces that fit exactly right. And that's what we call a knee replacement. Now, I understand that there are some risks and there are benefits to surgery. And the tricky part with any type of surgery is the post-surgical complications. And so there's things like infections, which are very common, especially in people who are immunosuppressed. So whenever your sister does have the surgery, they'll have to be very, very careful with her. If they continue her on any of the medication that the rheumatologist gave, she has a higher risk of developing infection. The second thing would be blood clots, circulation, because anytime you have surgery, it changes your veins, your arteries, your nerves. And some people can develop a blood clot, which can also be life-threatening. And then it sounds like she's going to have to be admitted for a little while to either a rehabilitation facility to get some strengthening afterward.
Yes, so the surgeon has recommended us to keep her at TIER in the medical center. It's a rehab center that will help her to maintain her knee and for her to do her daily base things instead of her coming home. Just because she has an autoimmune disease, they want her to be in an inpatient facility so that they can watch her and see how she's doing.
Good. I think that's a very appropriate step. And again, surgery after surgery is really the high-risk time frame. And so many people will be admitted to a nursing home or a skilled nursing facility or a rehab facility for monitoring. And the doctors there every day will come visit her. The physical therapist will work with her. And that way they can keep everything on track. There is a healing time. So it can take 2 weeks, 3 weeks, maybe longer to get someone functional again. But the people who go through knee arthroplasty are usually very grateful. So they're able to get their life, their independence back again. And so it is a very, very common procedure. And I was doing a little research earlier today. Each year in the United States, there are 600,000 knee surgeries, similar to the one that you talked about. And the second most common reason to have knee surgery of that type is rheumatoid arthritis. Number one is osteoarthritis. Osteoarthritis is just from old age. It's just from people whose bones break down after a while. And the third most common reason is traumatic injuries. So things like car accidents, motorcycle accidents, falls from a ladder, things that have happened, something was broken, and it didn't heal right. So osteoarthritis, rheumatoid arthritis, and trauma to the knee are all reasons to have knee arthroplasty. Do you have other thoughts or other questions or concerns?
I think one concern we would have is because she's been on so many steroids for such a long time, I think for anyone that would be concerned for her to have this surgery and for that to move into a different place or continuing those medicines, or will she be completely off of those?
Absolutely. Steroids are very good medicines, but they have side effects on the bones because high doses of steroids over many years will cause brittle bones. It makes them break more easily. And that's why the rheumatologist hopefully would be able to get her off of the steroids after surgery. But you're right. She could have rheumatoid arthritis flare-ups in other joints, elbows, ankles, the opposite knee as well. So only time will tell. Hopefully she'll improve to a point where she's independent again, but unfortunately there's no guarantee that she'll be pain-free, for the rest of her life. And she may develop other complications because autoimmune disorders, oftentimes they have overlap with thyroid problems. They have other issues with, liver, kidneys, and so on. So it's going to be a process. But hopefully she'll be able to get off a lot of the medication once her pain is much better after surgery.
Yeah,
Definitely.
hopefully.
Yes, absolutely. Any other concerns, any other thoughts that you had about your sister's care or other specialists that you had talked to?
I guess the other thing would be is for the future, how long do they last, the knee replacements?
Absolutely. And that's a very good point. So oftentimes the surgeons will delay surgery for as much as possible. And it could be not just someone who's 23 years old, but someone who's 55 or 65 years old. They try to push them as far as they can go before surgery. The reason is that just like the knee joint wears out, so do the orthopedic hardware joints, which is the titanium and all the other chemicals and structures that we talked about. So on a good situation, about 20 to 30 years, you would get good use out of an artificial knee joint. But if there's problems, it could wear out faster. And so if she's 23 now, maybe 24, 25 years old when she has the surgery, she might have to get another replacement at 45 or 55. And then she may have to do another replacement after that. So that's kind of the issue. Just like tires on your car, they have to be replaced and rotated. The knee is the largest joint in the human body, and it has to take all of your body weight.
Yeah.
We put weight on each leg one at a time, especially with stairs, squatting, bending, and so on. And that's really what happens, is that it's cumulative. So it's never one day that you develop arthritis. It's over many months or many years, and that would be the concern, is that she may have to get another replacement later in life. So,
Okay.
all right, excellent, very good. Well, I do hope you learned a little bit of information about rheumatoid arthritis and knee arthroplasty on today's episode. We'll have this show available on our website, simplehealthradio.com. It'll also have a blog with links, and we'll have some resources and information. You can follow us on Instagram, where we have a large following, and I do hope to have Sarah back on our show in the future, and I do hope you learned some good information today.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.